Adjustment disorder is not a disorder at all. And I know that in the DSM, which is the book that we use to diagnose, adjustment disorder is there, and it says, after a life event and the person is not adjusting, there's clinically significant symptoms that are present, and so therefore they are diagnosed with adjustment disorder. I'm a psychiatric nurse practitioner with over 20 years of clinical experience, and I rarely use the diagnosis of adjustment disorder. Sometimes I will use it as kind of a bridge of, I'm not quite sure what's going on. I don't want to give them a chronic diagnosis. However, there's definitely some clinically significant symptoms. But, honestly, it's just not, this is everyday stress, life. Right? And an adjustment, to call it a disorder is not fair. It is basically saying there is stress in the person's life and they're not adjusting well to it, right? So, you can see if you looked up adjustment disorder diagnostic criteria and what kind of things, stressors, it could be as simple as marriage or a breakup or death, grief. And oftentimes I feel like we, as professionals, we use adjustment disorder when we think, oh, actually, this person is responding how I probably would respond or how they should be responding. I'm unfortunately an expert in grief. I have lost 3 children over the course of 17 years. And oftentimes I'll have people say to me, I don't know how you're still standing, and so I feel like adjustment disorder is often used when we feel like this is a normal response to a stressor, and we as the professional would respond the same way. If you look in the descriptions, you will see a free grief course that I am offering, and because grief is a normal part of life. And yes, my grief is in the wrong order. I have lost my children, but it has caused me to really dig into what is grief and how do we grieve and how do we not have this adjustment disorder. And that's why I say adjustment disorder is not really a disorder. It is, how are you responding to stress in your life? So maybe you're watching this video because your doctor diagnosed you with adjustment disorder, or you're seeing a counselor and adjustment disorder is on your chart and you're like, what does that mean? Well, honestly, if you are in billing insurance, we have to have a diagnosis that we are treating when you're coming into counseling. So adjustment disorder is kind of the easiest thing to put on your chart to say, yes, this person needs counseling. It is medically necessary for this person to receive counseling. But this is also a normal thing in life that they're going through, whether it be grief or, even responding to changes in your environment. The time that I most frequently use adjustment disorder is as a commander in the Navy. So I am a psychiatric nurse practitioner in the Navy, and we often use adjustment disorder for various reasons in the Navy. One, a lot of other diagnoses have kind of a chronicity to them, right? Statistics say if you have major depression disorder, one single episode, you have a significant increased likelihood of additional episodes. And so giving an adjustment disorder diagnosis in order to begin treatment allows for that safety net of maybe this is not chronic. You see it a lot when I work the inpatient unit at a training center where young men and women come for basic training and they are not adjusting well. And then all of a sudden they have these pretty significant symptoms of depression, anxiety, maybe even threatening to hurt themselves while in basic training. We give a diagnosis of adjustment disorder due to military service for several reasons. One, it allows for a very simple administrative discharge from the military, and there's no recourse for that, right? Like you tried, you went to basic training, this is not the life for you. And, without putting any chronicity on it. So that is the purpose of this adjustment disorder diagnosis, to say that maybe this is just a exaggerated response to a stressful situation. But in my professional career as running a psychiatric clinic, nobody that walks in the door just has adjustment disorder. And that's typically because by the time someone seeks out psychiatry as a specialty, the symptoms are pretty severe, right? And so, someone will be experiencing, depression, anxiety, and that's typically not just an adjustment disorder, right? So that adjustment disorder as a single diagnosis is typically kind of a safety net where we can say that maybe this is not chronic, maybe this is just a response to their environment. But likely, if you are experiencing symptoms of depression and anxiety, if that is impacting your daily life, if you are unable to function well at work, or you're irritable and agitated and your anxiety feels like you don't have control of it. If it's impacting you in a physical way, right? You're unable to sleep. You are having trouble thinking through your problems, things like that. Those are all indications that this is probably either major depressive disorder or generalized anxiety disorder and not adjustment disorder. So, like I said, adjustment disorder is not a real disorder, but if you are presenting with lots of symptoms after a stressful event or while going through a stressful event, that doesn't mean you shouldn't seek help or treatment. And this is a nice way to, be able to do that. If we get to a point where we need to prescribe medication, we can no longer use adjustment disorder, right? Because medication is used for things like major depressive disorder, generalized anxiety. So adjustment disorder is for, maybe just counseling interventions without medication type interventions. I hope that makes sense, and continue to evaluate yourself, figure out how you're responding to your stress. Watch my video on anxiety is good and stress is necessary, and stress is growth.